Morning, Miss Barami.
Good morning, my lord. Our first witness this morning is Mrs. Gemma Barton of the Glasgow Disability Association.
Very good. Good morning, Mrs. Barton.
Good morning.
Right, on you go, Miss Barami, sorry.
Thank you, my lord. Mrs. Barton's statement reference for the record is SCI WT 0938-501. Good morning, Mrs. Barton. I would like to remind you that there is a restriction order in place, so other than the names of your children and husband, please don't mention any particular names.
Okay. Yep.
Thank you. Now, you live with your husband and two sons who are 6 and 8 years old, is that correct?
That's correct, yep.
Your younger son, Aaron, spent some time in the neonatal intensive care unit at the start of his life.
Yes.
And has lifelong health conditions as well as additional needs.
Yep.
Would you like to give us a brief summary of Aaron's life prior to 2020?
Yes. Do I read from the statement? Okay.
If you just want to tell us,
Okay.
that's fine too.
Yeah. Aaron was born by emergency C-section, and quite shortly after we realised that he was not a well child. He was back and forth to doctor and hospital, and when he was about 4 weeks old, he had a cardiac arrest en route to hospital because we knew he was showing signs of being very unwell. So that resulted in a long stay in hospital intensive care, where they did a lot of tests, and they found that he had a retropharyngeal abscess, which has caused lifelong damage to the top of his spine and damage to his spinal cord. So that's resulted in obviously lifelong conditions that affects his mobility, his speech, just all aspects of his life.
Thank you. And he has a tracheostomy, or had a tracheostomy,
yes.
and he currently uses a wheelchair, is that
Yes,
correct?
yes.
Yeah. Does he or did he have a gastrostomy tube as well?
He still has
one.
Yeah.
While he had his tracheostomy, did he require any daytime or nighttime ventilation as well?
With his tracheostomy, no.
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 Thank you. When the pandemic restrictions commenced in March 2020, was Aaron in nursery?
We had started the process of getting him to nursery, but because it was a mainstream nursery school, so they also had to put things in place for him to start, and also at that point he had his tracheostomy, so the nursery staff had to be trained in how to deal with somebody with a tracheostomy.
Yeah.
So it took quite a while, so he hadn't officially started as such. We were having sort of sessions where we would go in and spend a bit of time and just get the staff familiar with him and him with them.
Yeah. And it was a long process of doing that until March.
Yeah.
Did he attend any classes or sessions anywhere else, or have any health professionals attend the home prior to March?
Yeah, so we used to have the physio and OT would come to the house to help kind of assist with sort of kind of exercises and activities for Aaron.
Yeah. And I take it all that stopped once the restrictions were put in place.
Everything, yeah.
What was the immediate impact of that, of not having the allied health professionals come out, not having any respite essentially from Aaron going to nursery?
Yeah, it was exhausting and scary and just really difficult, because already it was a difficult time for us because we're still coming to terms with Aaron's health and the complexity of his needs, and we just felt really isolated, and obviously we're worried for the future for Aaron, the implications of this, everything stopping, because what he was getting at that time was minimal. So it was, for that to stop was just, it wasn't good.
Thank you. You tell us in your statement that Aaron was placed on the shielding list. Did that happen right at the outset?
Pretty much, yes. We got a letter to say that he was on the shielding list, which obviously we didn't know a lot about, or no, I suppose nobody really knew much about, and we weren't aware he was going to be on the shielding list, but I suppose it made sense given that he was vulnerable and just as a way of protecting him.
Did shielding bring a set of challenges, additional challenges?
Yeah,
Would you like to tell us about those challenges?
Yeah, so it meant that when we read the letter, it basically stipulated that we would have to shield and stay at home, and again it just made everything that was already difficult more so, because then we had two very young children in the house, and no support, no input. It was a scary time. Yeah, it was pretty scary.
Did your children want to go to nursery?
Yeah, so they were so Rory was still at nursery, so he was about 4, and where we stayed at the time, we stayed right across the road from the nursery, so you could see it from our garden, so trying to obviously explain to a 4-year-old that the nursery's there but you can't go there today, and it was very difficult, and he got upset, and it was frustrating.
And did you, before having to shield him for the restrictions, did you have support from your mother?
Yes, yeah. That was pretty much our only form of support. Like, my mum I'm also close to my mum, so she was very involved with us and with the children. So and then to shield, we didn't see her, obviously didn't see anybody, and she was shielding for fear for her own health, but also she was always really scared that she would pass something to Aaron. So
and did Aaron's tracheostomy add to those challenges as well?
Yes, definitely. So when they started to reopen the nursery and schools, we were told that Aaron couldn't go back to nursery because he had a tracheostomy, and we had meetings and discussions and things, but basically NHS Lanarkshire, I like to say that, sorry.
That's okay.
They had basically deemed that it was unsafe due to, I believe it was called an aerosol generating procedure, was created from the suctioning of the tracheostomy. So basically said Aaron couldn't go back to nursery.
They said that they didn't have any space to carry out aerosol generated procedures.
Yes, and the nursery didn't have space, so then they suggested maybe Aaron go into a different nursery, but we just felt that wasn't suitable because we'd already put in the work for him. It was established with the staff and the children there, plus, like I say, the nursery was across the road from our house, so it made me feel comforted that I could get to the nursery quickly if there was an emergency or if needed. I just preferred to be close.
They weren't willing to consider the option of creating a space to carry out suction on the tracheostomy or putting in place anything additional?
No, they suggested Aaron come to the garden to visit the other children for a kind of allocated time each day, but given that we were now getting into autumn, into winter, it just
wasn't feasible.
That was not feasible to stand out in the freezing cold.
And during the pandemic, did you have any issues getting medical supplies for Aaron? Things that might have been needed for his tracheostomy or his PEG, or medicines?
So before the pandemic, I would go and order the stock medical supplies and pick them up, and then during lockdown we got this supplies delivered to our house, which was one of the staff who very kindly took it upon himself to bring it to our house, and there was on some occasions issues with limited stock for his tracheostomy, and I did sometimes have to go to the children's hospital to get things that were running low, and it just seemed to be happening across the board. I knew other families who were having similar struggles. getting certain supplies.
Yeah. Was that because of a general shortage of the supply,
think
or was
so,
it a distribution problem?
I'm not
You're
sure,
not sure.
sorry, I don't really know why.
Thank you. And I think another issue with the nursery was providing Aaron with meals. Aaron was on a blended diet
Yes.
at that point.
Yes.
Did they refuse to provide him with those?
Yeah, there was because it'd never been done before, there was quite a lot of kind of to and fro, and so the way around it was I used to feed Aaron before he went to nursery, and then he was there for maybe 3-4 hours, and then I would feed him when he came home, so he'd only just get water when he was at nursery, because at that time the staff weren't trained or hadn't had adequate training to give a blended diet, but eventually that came about much later.
Was the water given orally, or was that given through the gastrostomy?
Through his gastrostomy, yeah. Aaron's nil by mouth, so can't have anything orally.
Okay. Why was the training? Why had the staff not been trained yet? Had the local authority or the local health board put that on hold because of the pandemic?
Yeah, I think it was just everything had been put on hold, and everything, it was just a backlog, and yeah, it just took a long time to get because it had been the community nursing team that have to go out and train the staff, so yeah, it was just down to not having, just a backlog of.
And that's not something they got to prior to the pandemic when you had the settling in period?
No, not at that point, no.
I mean, something like providing a child with food through the day seems quite a basic necessity. What were your thoughts on that being overlooked? Something so obvious in some ways?
Yeah, it still just doesn't make sense to me. I don't understand why. Like I say, my husband and I can feed him, and my mum can feed. Like, it's something quite straightforward. Doesn't need a lot of training. Like, we didn't get any training to do these things. So yeah, it's very frustrating. It's not great.
Thank you. Then, are the issues with the nursery what led the Glasgow Children's Hospital to then reconsider removing the tracheostomy, or is that something that might have happened at that point anyway?
No, it wouldn't have happened, especially at that time of year, because they had tried prior at other times to remove the tracheostomy, but they always said that they would always do it in the kind of spring, summertime when there's less chance of like winter bugs and things, so they would never usually do it in November, which is when they did try it, but it was only because he wasn't able to get to nursery, and I was contacting the staff at the Children's Hospital asking for their help in any way to speak to the health board and the council to try and get round ways to get back to nursery. So it was because of that they said they would attempt to take the decannulation, as it's called, for his tracheostomy. Yep.
And that was November 2020. Yes. Would you like to tell us about the procedure that took place for that?
So
your experience of going to hospital.
So we went. So we arranged to go to the hospital, and it was in a ward that Aaron and ourselves were very familiar with. Like I say, because he'd spent quite a lot of time in hospital already, so we knew the staff fairly well. Obviously, there was that fear about going into hospital, about like with this distancing and wearing the right PPE, and the staff, as far as we were, didn't have a lot of access to that, so it seemed quite relaxed, or more relaxed than I was expecting. But the procedure itself, basically, they take the tracheostomy out and they cover it up, and then it's basically a case of monitoring Aaron, see how he copes breathing without the tube in it, which it's not a nice thing to witness. It's really scary, but thankfully that time he managed to cope really well without the tube, like I say, with it covered up. And then they just build on that over a matter of hours, and then we stayed in overnight and just keep monitoring him. And then, yeah, it just becomes a case of just putting a dressing over it, and it heals up. And he went then for surgery and got the stoma stitched up a couple of days later.
Okay. And so did you just stay for one night on that occasion?
No, we were there, he was there for like, I would say, it was like a few days. Yeah.
What was it like being there with pandemic restrictions at that point?
Yeah, it was quite intense. Yeah, it was quite scary, and like I say, it wasn't as with the PP and things wasn't as prevalent as what I had expected to be.
Is that compared to the community team that came to your house?
Yes, because we had an experience where the community nurse came to the house, and she got ready out in the garden before she came in, and she had the full blue kind of suit covering the face covering, and gloves, 2 pairs of gloves, coverings over her feet, things like that. It was, yeah.
Whereas in hospital, was it a blue surgical mask, gloves and an apron?
Yeah.
And were your husband and your other son allowed to visit while you were there?
No, so Rory wasn't able to come to the hospital. They weren't allowing children into the ward. But at that time they allowed, it was meant to be just one, but they, Gemma and I were allowed to go in at that time, as long as we stayed in the room, because it was all single rooms. Yeah. So as long as we stayed in the room, he could come.
And do you know, before they could confirm that surgery could go ahead, did they have to make sure there was space in the paediatric intensive care unit, or were they happy to go ahead regardless of that?
Yeah, so I think they normally would have checked that there was a bed available if needed, but thankfully didn't need that. Yeah. Yeah, but no, they did. I'm sure they did check. Yeah.
Yeah. So that was another factor that could have affected things.
Yes.
Thank you. So once the tracheostomy was out, was Aaron able to then attend nursery, or did issues continue?
Yeah, so once the tracheostomy was out, yeah, he was able to attend, but again, it was just a kind of period of settling in and familiarising him with the staff, and the staff with him, and his other kind of needs that was needing addressed.
Yeah, because in paragraph 30 you state that you felt that again South Lanarkshire Council and NHS Lanarkshire were putting unreasonable barriers in the way. You say that Aaron is in a wheelchair, so he's not up running about and he's not touching things. They were in control of what he came into contact with. I take it that was after the tracheostomy was out, is that correct?
No, I think that goes back to when he had the tracheostomy. Because of part of the reason they were saying that he was a risk to other children, I was just felt that, well, with Aaron and his abilities, he wasn't actually able to touch things and spread germs, in my views, compared to other children who are more able-bodied and able to run about and pick up toys and things like that, whereas he wasn't doing that. We sort of control what Aaron comes into contact with. Yeah. So, yeah.
Did they say that that was an issue once the tracheostomy was out, or were they quite content that that wasn't an issue?
Yeah, I would say that, that they were happy for things to move on, and that was less of an issue.
Okay. Yeah. And by that point, had they been trained in providing a blended diet through the gastrostomy tube?
Not at that time. That was still ongoing.
Okay.
It hadn't been completed at that point.
And you mentioned that you had to get in touch with the local papers and you had to contact Claire Hoy MSP.
Yeah, that was again when I was told he wasn't able to go to nursery because of his tracheostomy. Yeah, I contacted our local paper and, like I say, the MSP to see if there's anything they could do to help get him back into nursery.
And what response did you get from Ms. Hoy?
Yeah, I got a letter just to say that they were liaising with the health board and the council to see if there was other things that they could do, you know, but I think really they were hoping that we would try and get Aaron into another nursery in the meantime, but like I say, I didn't want to do that.
Yeah. Okay. Now, prior to the pandemic restrictions being put in place, you were able to have occasional respite at Robin House, which is owned by children's hospices across Scotland, but that stopped because of the restrictions. What was the impact on each member of the family of not being able to have that respite?
Yeah, it was just really difficult, and like I say, it was really tiring because at that point Aaron had a lot of issues with sleeping, so he was up quite a lot frequently each night. So husband and I, or Gemma and I, would take a lot of turns about to stay up with him. So like sleep deprivation was quite a lot. And Rory, our other son, he really enjoys going to Robin House and gets a lot from it, and be able to mix with other siblings and other families. And again, being told that we can't go and trying to explain that to a really young child's difficult in itself. Yeah. So yeah, it was just, we felt really isolated.
Thank you. In paragraph 40, you speak about Aaron's community physiotherapist and occupational therapist not coming out during the pandemic and the sessions resuming once he had started school. You say the difference in him is incredible. Can you tell us, please, about the physical and cognitive effects when therapy stopped and then the effects once it started again?
Yeah, so...
And, sorry, could you also clarify exactly how long the therapies stopped?
I would have said it would be at least a few months.
Okay.
Because it would have stopped around about, kind of, what would that be, March sort of time, and then they wouldn't have started till later that year. So yeah, I would say it would be a good few months without the input from the community team. So yeah, it was just difficult. And when his physio did start coming out, wearing PPE, because we had tried doing some of the sessions through Zoom, but we just felt that Aaron just couldn't engage, because obviously he was really still young, very young at the time, and trying to engage him through a screen was just really, really difficult. And I felt really frustrated having to try and do a lot of the work and the exercises myself, because a lot of them it was like two people having to do them, so it was, yeah, it just didn't work. So Aaron was increasingly frustrated, because obviously that was a really critical time, the age he was at, of learning things and having the input to increase his skill set. And yeah, I felt like he just sort of plateaued and everything kind of came to a halt. But then we saw such a difference in him. Now he's at school because he gets those therapies regularly each week, and he's just doing so much more than we expected him ever to do. So it just shows that having that regular input from the therapies, just the difference has been remarkable.
Yeah. Would you like to give us a few examples of things that he started being able to do?
Yeah, so he can sit up unaided, which is something that we never thought he would be capable of doing. And he started to do it, so he can sit up. And just very recently, the teacher at school commented she thought he looked like he was trying to crawl, which again is, if you know Aaron, it's quite mind-blowing, just given from where he came from to where he's at now, is quite incredible. So yeah, and that's just in quite a short space of time.
Yeah, and to your mind, that's the effect of the therapy. Without the therapy resuming, he wouldn't be,
No,
he wouldn't have
definitely.
reached those milestones or be close
And
yet.
even just being with other children, just being amongst his peers, and he watches the kids and gets so much back from being in their company and obviously observing them, and yeah, it's great to see now.
Yeah. So really, would it be correct to say that you're of the view that these therapies shouldn't stop in difficult times even, and that access to places such as nurseries shouldn't be suspended or prevented for children with additional needs?
Definitely, yeah. I think it's hard enough to get these kind of services and things put in place in the beginning anyway, and yeah, in places like nurseries and schools is such an ideal place because, like I say, they're in amongst other children and it just all seems to tie in well, like, and yeah, it's important.
Thank you. Now, you say in your statement you tried to provide Aaron with physio yourself while that had stopped. Could you tell us how that went practically and the impact that that had on you and on Aaron?
Yeah, it didn't go well because I think a lot of it was because I'm his mum and I'm not said person that's his physio, or so it was just difficult trying. He just thought it was a game and it was fun, and trying to actually do required exercise and things was just, yeah, it became really frustrating for myself, and then I felt really guilty because I felt like I wasn't doing it properly, and then he's missing out on this, and yeah, it was just a vicious circle, and yeah, I just thought it's not, whatever I try to do is not benefiting Aaron. I'm not doing the right things each time, so.
Did you feel like you had to be doing things like that any time you were spending any time with Aaron?
Yeah.
Rather than any of the typical things that a mum and child might do?
Yeah, I was like, his physio, his nurse, his pharmacist, his everything, yeah, all rolled into one.
Thank you. In paragraphs 45 and 46, you mention Aaron needing an adapted toilet seat and needing a wheelchair. Would you like to tell us about the challenges you faced with each of those and how the pandemic perhaps made the challenges more difficult than they would have been otherwise?
Yeah, so we had asked for a seat for the toilet for Aaron I'd discussed it kind of a while ago with the community OT, and obviously the pandemic just put a halt to everything, so then that was just shelved, and once things started to pick up again, I raised the issue and I thought it would really benefit for him, and I was told that they didn't have the equipment that I kind of requested or suggested that he get, which, I mean, I did a quick online search and I could find the piece of equipment that I was talking about, so I knew they were out there, you could get them, but I was told by social work OT that they didn't have those pieces of equipment available, and there was just, like I say, it was just a lot of time kind of waste, just back and forth, and just very unhelpful, and frustrating again, and to eventually they sent out adult equipment, but at this point Aaron was barely 3 years old and really small and very, very slim, and yeah, it was a complete waste of time. So I took it upon myself to contact Chaz, and they have a really great support team for families and to help with like funding applications and things like that. So we managed to get funding to help pay for the toilet seat, and bought one with those funds, and yeah, it's just been a game changer for Aaron. It's really benefited him, and his health's really improved through getting that. So yeah, it's just the length of time that it took It was ridiculous.
And would you like to tell us about the wheelchair as well?
Yeah, so again, similar. It just these things were all, you know, meant to be kind of in the process of happening. But again, the pandemic put a halt to everything with that. So he ended up with a buggy as his own only means of getting around, for far longer than probably what he should have. And then by the time he had to set up appointments to get the wheelchair, the parts and things like that all seemed to be taking a lot longer than I'm guessing normally would to come from America and other places. So again, it was a huge wait to get a wheelchair, which again has really benefited Aaron, because being in a buggy was not, it was okay when he was very young, but not when he was about to start school. Wheelchair was much better.
Thank you. Now, in 2021, Aaron was referred to a spinal cord injury specialist. Would you like to, now the specialist himself was in England, but would you like to tell us about the procedure in Scotland for being referred and how things went with the specialist and the consequences back up in Scotland?
Yeah, so we had met, so his neurology consultant at the Children's Hospital in Glasgow had suggested that we meet with the team from the Stoke Mandeville Hospital, and that had happened when Aaron was really quite young, and they'd always talked about us eventually going down to visit to see the doctors there. But however, again because of the pandemic, that got put on hold, and then we eventually got an appointment to go down, and yeah, we had to fly down, and it took quite a lot of arranging and things like that, but yeah, we flew down there and we stayed for 5 days, and it was just like an assessment sort of period, so they just kind of looked into ways that they might be able to better support Aaron and his needs and things like that, and if there's anything that maybe he hadn't been getting it in Glasgow, if they could help with anything like that.
And did the support you were getting in Glasgow change, or the treatments change as a result of that assessment?
The main thing that changed was when we were speaking to one of the doctor there, she'd asked about Aaron's care package, or kept referring to a care package, and I had said that he didn't have such a thing. I didn't know about anything like that for him at that time. So her secretary contacted South Lanarkshire Council and asked about Aaron being referred to social work in order to start the process for self-direct support, which is a huge thing. Like I didn't at the time think about that or considered that.
Now, I take it that made a big difference for all of you, having that. Did you wonder why that hadn't been put in place sooner? Or do you think it was a result of the pandemic that was overlooked, or does it predate the pandemic?
Probably, I'm not sure, to be honest. It probably predates it, but again, the pandemic's probably put, like I say, everything just got shelved, and it just made everything
delayed it further.
Take longer, yeah.
Thank you. You talk about the financial impact of the pandemic on you. Would you like to tell us a bit about that?
Sure, yeah. So at the time I wasn't working, so I stayed at home and looked after the children, and my husband worked full time. But then due to the pandemic, he was put on furlough for a few months, but then as a result the company decided that they had to reduce the workforce, so he was made redundant, which was obviously huge, had a huge impact for the family.
And now you work at the Glasgow Disability Alliance. How important has that been for your mental health?
It's been really huge. Yeah. I, it was. I was aware of the work that they did through jobs that I had in the past, and like yeah, the support that I get from my colleagues, and yeah, it's made a big difference in getting up and going to work and just having a purpose and knowing that I'm doing something that I really enjoy, and you know I'm helping people, which is something that I've always wanted to do in my work. It's meant a lot. So yeah.
In paragraph 65 of your statement, you say, whilst working for an equalities organisation has given me direct support, it has been a real shock to see how many disabled people are still struggling. The cuts in social care support before, during and after the pandemic is alarming. Now, we've touched briefly on the fact that your view is that therapies and support for disabled people should continue without disruption in the event of another pandemic. Would you like to expand on your statement there? Is there anything you'd like to add to that or go into further detail?
Yeah. So at the part that you just, sorry, it's been a short seeing my too, but I still struggle. Right, sorry. Yeah. Yeah, I suppose knowing other, or well, ourselves, the experience we've had, and just how long it takes to, you know, get the basic things that Aaron needs, and just seeing other people, like through, like with the work that I do now, like speaking to people, and so many people are just shut off, and things have closed or services have stopped and they've not restarted, and there's just so many people that are basically isolated. So I think I said that earlier, that we felt isolated, and I think a lot of people still feel like that way. And yeah, I feel like things have kind of gone back and or stopped. And it's a real shame to see.
Thank you. Now, we have your entire statement and we'll consider that in its whole alongside your oral evidence today. But is there anything we haven't covered today that you would like to mention or highlight at this point?
I don't think so. No, not at the moment.
Okay.
No, thanks.
Do you feel you've been heard today?
Yes. Yes, I do.
Thank you very much.
Thank you.
Yes, thank you very much indeed, Mrs. Barton. Grateful. That's all. Now we're ahead of schedule, Ms. Barami. I'm not sure if the other witnesses, the next witness is ready or not. We're due to start at 11:15. Perfectly happy to start at about 11 o'clock if the witness is ready, if I can be told. But
Yes.
if not, we'll start at 11:15.
My Lord, my understanding is that the witness is here and that shouldn't be an issue. Starting
11
earlier.
o'clock should be all right.
Yes.
That would be fine. And that's all right with you, is it?
Yes, my Lord, thank you.
Very good. That's what we'll do then. Thank you.
Thank you.
So all yours was just appeared on the screen.
All right.
Now, good morning again, Ms. Barami.
Good morning, my lord. Our next witness is David Kelter, also of the Glasgow Disability Alliance. His statement reference for the record is SCI WT 0289-501.
Thank you, and good morning to you, Mr. Kelter.
Well,
Good. If you're ready, just please, on you go, Ms. Barami.
Thank you, my lord. Good morning, Mr. Kelter. I'm Farima Bahrami, Junior Counsel to the inquiry. I spoke with you just earlier today. Before we start, I'd like to remind you that there is a restriction order in place, so please try your best not to mention the names of any individuals. You may mention Teresa Burke and the name of your GP, but please don't mention any other names. You currently work for Social Security Scotland, is that correct?
yep.
And you've had a visual impairment for the last 45 years. Would you
Yes.
like to tell us about the extent of that and the consequences of...
Sorry, you're quite quiet. I'm finding it difficult to hear you, sadly.
Sorry. Would you like to tell us about the extent of your visual impairment and the consequences of that?
In recent times or in the past or?
I suppose in recent times.
Yep. I've been living with visual impairment, as you say, for 45 years as a result of a respiratory arrest, or 2 respiratory arrests when I was 15. Fortunately, because I was so young, I managed to get good recovery because I was left totally paralysed and totally blind, but the brain adapted and I got recovery. But it took me down a different road in terms of upbringing. I had to move to the family home into care. I had to go to a different school, learn new skills, particularly Braille, and how to use a QWERTY keyboard. So the whole kind of, structure changed for that perspective. Probably for the positive, because I lived in a fairly destructive family background. I'd been in care before through as a result of living in a family with an abusive parent, so I was used to living in care, and primarily my health was aggravated by the stress of living in a violent background. So it was, it was a positive. It might sound a bit ironic, but it was a positive thing to have the brain injury and go into care and go down a different route, and subsequently worked out for the best because I was in a care and supportive environment. I could start to build up trust with people, and was in an environment where I began to realise the potential, and I was fortunate, had the support, went to uni, blah blah. The rest is history.
Yeah, thank you. And I suppose I'm keen to get an understanding of how severely impacted your vision is, how it affects your daily life. And then I'd like to ask you about the supports you had prior to pandemic restrictions being put in place to help you navigate your life, really.
Well, I'm registered blind. It means that I don't have any clarity of vision beyond 3 feet.
Okay.
So I'm registered blind. The best analogy I can paint for people is that my eyesight's, if you're old enough to remember, and I apologise if you know, if you open your eyes in a heavily chlorinated swimming pool, all you see is that mist and bubbles. That's what my eyesight's like. I don't have any distance vision. I can't read print. So it's I don't have any functional vision in terms of maybe kind of mobility and coordinating. Kind of in the wider world, but for finite things, like independent living skills and independent travel is quite difficult. I've not bought a newspaper in 45 years, because my vision's not that good. But partly that as well is coordination. With my brain injury, I've got, I don't have great hand-eye coordination. I've got a tremor, so I find it difficult to coordinate as well.
Yeah, and prior to the onset of the pandemic, did you have support support from anyone? Did you have carers attending your home, or did you go to any day services that helped?
I needed support because obviously my family environment kind of broke down 2 years after I had my latest brain injury, and I was living more myself. So I had to liaise with social services to try and get some community support, and it was a bit hit and miss. You know, I kind of got there in the end with 2 support workers that helped me live a degree more independently in terms of just doing day-to-day stuff, primarily independent travel, kind of domestic engineering, you know, the cooking, the hoovering, the blah, 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 that sort of stuff.
Yeah.
So I needed the support with that. And as I said, for a couple of years, just prior to COVID, that was in place, it was established. And I had two personal assistants that I got really well with. They knew the ropes and provided a fairly supportive, barrier-free support mechanism.
Yeah. Once the pandemic restrictions were put in place, how did all that change?
Effectively, you know, like many other peers, there was no support whatsoever, and that prevailed for probably, if my memory says me right, for about 13, 14 months. I didn't have any community support, despite, you know, trying to get back to the 2 people I was using.
Yeah.
They had restrictions in terms of, you know, their organisation laying down guidelines. Yeah. Then there was more people needing support. Then their time was taken up by that. So it was the support was non-existent, unfortunately.
Who had what organisation had provided the carers that you had?
I was using the local authority.
And so what did the local authority expect you to do without the care that had been deemed necessary for you?
Well, I tried to contact and get the support, and the bottom line was that I wasn't a priority group, and they had no idea what timescale before the community support would be back in place, and the people that they had allocated to myself, they had other priorities. Where there was after about 6 or 7 months, they had an overstretched caseload, and therefore I wasn't a priority.
How did you do your grocery shopping in the absence of a carer?
For the first, again, I apologise, my memory's not great because of my brain injury, but for the first 5 to 6 months, I didn't have any community support. And because of where I live, a lot of the supermarkets don't deliver. I live in a tower block, so the supermarkets don't deliver. They didn't at the time, I way back in 2021. So I didn't know where to turn. I was trying to get support. I was trying to go online to see what was in the community, but because I wasn't part of the protected population, people said that they couldn't provide me with the support, and if they did provide me with the support, it was a one-off as a favour. So it was really, really, really difficult, you know, to get the support. And if it wasn't for, like, you know, friends in my local pub and Glasgow Disability Alliance. For that 6 months, you know, I would have no access to food. Yeah. And obviously,
and despite that, the local authority deemed that you weren't a priority, even though you couldn't even get basic food.
Yeah. I mean, when I tried to contact them through the Scottish Government Emergency helpline, you know, I never get through. I was told, well, I did get through. I was told 3 separate occasions somebody would contact me. They appreciate my personal circumstances, and nobody ever get back to me. So I was plan B. I had to find a solution myself and try and go online to see what was there. But sadly, the provision that, in terms of the food, it wasn't the ideal, because of my visual impairment, I found it difficult to identify the products people were giving me and how to cook them and so forth. And obviously, I don't have an accessible kitchen. I don't have a talking cooker. They're talking microwaves, so it was difficult to cook. So it was a steep learning curve, and I basically adapted. I went back to the social model of disability, and I basically adapted, and I built up this new sense of independent living. What can I do for myself?
Yeah.
And that's how I live.
Yeah. And in relation to supermarkets delivering food, I understand that the only organisation that seemed to get anything done, so really through the local authority there was nothing, but the Royal National Institute for the Blind intervened, is that correct? And
Yeah, I think they appreciated that there was a lot of people like myself with a visual impairment who weren't part of the protected groups, and therefore weren't entitled to the community support. And they engaged with, you know, a retailer and to see if they could provide support and home delivery, etc., to people with visual impairment. To get food.
in tower blocks as well.
The tower block, that was a bar right away. But obviously through the RNIB, they liaised with this wholesaler, you know, this retailer, and after about, I think it was probably around about September, October, they finalised an arrangement, you know, with this retailer, and they started to deliver. But I think, just to be slightly pernickety, when you're got a visual impairment, you know, you build up a routine. I was used to using another retailer, and I was familiar with the product, you know, the shapes, the size, the colour, so forth. And to go to another retailer, I found that the transition wasn't as smooth as I'd hoped. I had to try things, to try and recognise them, I had to restrict my diet and so forth until I could get more familiar with the products that they offered. And at that time, I still didn't have any, you know, community support in terms of, you know, kind of cooking and so forth.
Yeah. And is it correct to say that your view is that manufacturers should be required to put Braille on packaging so that people with visual impairments can figure out what tins are, for example?
That would be excellent, you know, and I would personally find that good. We were just talking about it earlier on, that when you use your local pharmacist, they Braille. You've got grade 1 Braille on the products you get for them, and that's a great help because you appreciate that, you know, tablets change, different packaging, different colours, different shapes of boxes, and to have that grade 1 Braille on the packaging is a great help. It's stress-free. You can live it more independently, and especially when you're taking tablets and inhalers at, you know, 2 in the morning, you don't need somebody to tell you what it is.
Yes.
Because you've got it in the box and the packaging. You know, I mean, you get different inhalers, different colours. You know, that can be challenging. Same shape but different colours. So, you know, it's good to have that label. Yeah.
And what other tasks and activities were affected by the lack of having a carer?
What do you mean, sorry?
So, you know, you had, prior to the pandemic, the support of a carer to go about your daily life.
Yeah.
And we've spoken about issues that you faced, grocery shopping and preparing meals. What other aspects of your life were impacted by not having a carer anymore? Basically
everything that involved kind of doing something independently, travelling and using a piece of equipment. You know, I don't have a washing machine, so I'm reliant on, you know, a communal laundrette, and that was totally inaccessible. Yes. You know, I don't want to kind of start a joke here, but I didn't have any pals after 5 months. You know what I mean? You know, kind of nobody able to access your laundry. So there was no adaptation by my local authority. You know, everything was, you know, they presented everything after 2 or 3 months. They assumed everybody was in the sighted world, and they were just putting up more barriers. They weren't, you know, providing solutions. So things like accessing the laundry, you know, kind of, you know, that sort of stuff was really, really difficult.
Thank you. And I want to come back to the laundry issue shortly. Were you ever put on a shielding list?
No, I did inquire with the local authority, and I did contact both my MP and my MSP. I'd explained to them my predicament, with my visual impairment, my brain injury, and the fact that I was chronic asthmatic. That was really apprehensive that if I did catch COVID, with that respiratory disease, I didn't feel secure. But sadly, presumably my elected members were inundated, and they gave me the answer. One of them replied, the other one didn't. Yeah. So there was, it made it quite clear quite quickly that because of my visual impairment, I wasn't in the protected group, and there was nothing set up, and therefore I was advised to try and find alternative support.
Yeah. And those elected representatives were Claire Adamson, MSP, and Marion Fellows.
Yeah.
So the person who replied to you, what was the response you received?
Well, I did contact by email both of them. Well, my memory is playing tricks with me. I'm trying to remember who it was that replied. I think it may have been Miss Fellows, because you had links with the visual impaired community. But again, the best support advice you could give me was to get back to the authority. She wasn't in a position to instigate anything because I wasn't part of the protected group. I may be misquoting. Sorry?
The food pantry at the church as well. Yeah,
my colleague just reminded me that I did get a lot of support for the local church. That was a godsend. Yeah. The GDA was a godsend. Even though I don't like butter beans, but it was still a godsend.
Yeah. But in terms of your MSP and MP, they didn't do anything for you, and you asked them about accessing support for food as well, and they didn't help you in any way in relation to that, or the shielding list, or any other issue that you raised?
I presume their hands were tied as well. They were playing catch up. It was a unique scenario. So they were obviously trying to keep ahead of everybody else, but they offered me nothing, absolutely nothing. But it doesn't surprise me. I live in a local authority that, in conjunction with the two elected members, they don't, it's only the last 18 months that they started to communicate with people with a visual impairment in an accessible format. So it was disappointing, but it wasn't surprising because of my history dealing with the local authority and the elected members to try and find a more accessible environment at such a crucial time.
And I wanted to ask you about that, given the lack of in-person communication during the pandemic and the fact that many local authority offices weren't staffed, even for phone calls. How easy or difficult did you find communicating with organisations and other professionals?
It was virtually non-existent. It was impossible. Someday the local authority did send me a pack, transpired later on it was local contact, but I did specify that I don't read print, and therefore any communication would have been ideally electronic or in Braille. Yeah. And sadly, again, it just fell into a black hole.
They seem to take no notice.
Sorry?
They seem to take no notice of your need or the need to make reasonable accommodations.
They didn't act positively or come up with another alternative, so I can't say they were negative. I mean, the demands on the services, particularly in the first lockdown, it was everybody was learning and adapting and trying to support. But I'm just saying, for a visual impaired person's perspective, my experience was, was living in a black hole with nothing.
And for electronic communication, you have software called Job Access with Speech or JAWS, and that allows you to hear what the contents of an email are and presumably to also respond using that. Is that correct? Yeah, Glasgow Disability Alliance had provided me with a laptop and the programme,
and for anybody that doesn't know, the programme could cost between £600 and £800, so it's quite expensive for a lot of disabled people that may not have that money. So a couple of years earlier, I'd enrolled to, in several groups within Glasgow Disability Alliance to kind of build up my personal confidence, because I had been made redundant and had personal kind of my personal circumstances changed. So I was in a kind of really dark place, and I liaised with GDA, and they put everything in place and they helped build my confidence up, but they provided me with the support. So that, as a result of getting the laptop with the software, which would have cost me about £900 to £1,000, I was able to live more independently to a greater extent. But again, that was thanks to GDA.
Yeah. Yeah. And that would have really been a very simple adjustment if they just communicated with you through email rather than post, and quicker too.
Yeah. But as I said to you before, it was only in 2021 that the local authority, deemed that they had the structure to communicate with people with a visual or print impairment. They said their systems, for 2001 to 2021 weren't accessible to email people. And obviously, surprise, surprise, when the 2010 Equality Act kind of kicked in, with a bit more power for people, suddenly North Lanarkshire local authority found a way to email you. But I know it's maybe not relevant, but I think it's pertinent to mention that a lot of people with visual impairment live in environments where there's barriers that don't have to be there, especially in this technological age.
Yeah.
So that's just an aside, sorry.
No, thank you. In paragraph 26, you state, I was basically housebound and didn't leave the house for 5.5 months.
Well,
Please would you tell us about the impact of that on you? And could that have been avoided if you'd been provided with, if your carer services had continued?
yeah, possibly. I mean, as I said, the carer stopped. Nobody knew. I would have guaranteed of getting a carer. The isolation, maybe I could have went out, but I wasn't sure whether to go out because of my, my kind of, my personal health and so forth, and possible impact. So it would have been nice to have had that support. It would be nice to have some social interaction. It would have been nice to pop out into the community. But again, because of my visual impairment, I was sort of concerned that I wouldn't be able to keep, kind of social distance. And again, it was an unknown quantity for me, and I couldn't run the risk of, coming into contact with somebody. So I just went into voluntary lockdown and, try to get support where I could.
Yeah. What was the impact of that on your mental health, not being able to go out?
I think again, and I'm making the apology for reiterating this. If it wasn't for the sharp action of Glasgow Disability Alliance, I would have been 100% totally isolated. So they set up, kind of groups, social contact. So you had that basically on a weekly, fortnightly basis, where you had that contact, and you could, kind of get stuff off your chest and get information, and obviously they had a support service, that they ran for a while, where people like myself, if they needed the additional support and were finding the isolation overwhelming, you had somebody at the end of your phone. They provided you with a mobile straight through, hot desk, brilliant.
Yeah. And did the Glasgow Disability Alliance also set up Zoom calls with your peers and others?
Yeah. They did all the technical stuff, and as I said, through primarily their Drivers for Change group, there was regular meetings to look at, social aspects, policy issues, kind of, galvanising, making sure people were had a voice if they needed to be heard, what support was there, exchange information with other disabled people. It was a great resource, not just in terms of getting advice, information, but also made you aware you weren't alone, and you weren't the only person within your community being alienated and isolated, and no receiving a service for your local authority. So it was good in that respect as well. That and again, you know, GDA provided practical support as well, which was very beneficial. But yeah, that social link was a godsend.
Yeah, thank you. And you mention in paragraph 56 that through the GDA and these online meetings, you, along with others, met with ministers from the Scottish Government and councillors from Glasgow who were willing to listen to what you had to say. What kind of things did you speak to them about, and what was the outcome of those meetings?
I need Glasgow Disability to remind me about this, but I think it was getting a voice, and you know, a lot of the stuff I've said before about the lack of provision for people with a sensory impairment, you know, the lack of you know, kind of local support, and people just being left isolated and we need support. I think that the questions were being asked. Unfortunately, we weren't getting great answers, but we had a platform to purge myself and, you know, feel that, you know, our voice was being heard, and that we could possibly, because we didn't know how long this pandemic would last, how many other lockdowns and so forth. So it was good to know it was here, but I'm a wee bit rusty in terms of the meeting, maybe.
Is that in the vaccination programme and stuff as well?
All right, yeah, my colleague just reminded me about the vaccination. That was one of the key issues that which really surprised me. That again, there wasn't any additional support mechanisms in place for somebody who lives a cell who's got a visual impairment, trying to access an alien environment. We need support. You know, they sent you a letter in print. Again, you know, you had to get somebody else to access that. You had to go to a resource that you couldn't navigate. It was completely alien. It changed every year. And this last year, I was hesitant about subjecting myself to that completely inaccessible, inverted commas, hostile environment. You know, fortunate enough I got support and I was able to do it, but I think the fact that we didn't have that community option, you know, to go somewhere, you know, if you're visually impaired, it takes you a wee while to become familiar with a new environment, and you need somebody who's kind of educated and guiding and describing, and it wasn't my most enjoyable experiences.
Yeah. Could you tell us about attending the vaccination centre? What was it like in terms of arriving, going to the area that you were supposed to be in, waiting your turn, being called, having the vaccine? Could you tell us how all of that went? You know, went for you given your visual impairment?
Well, I think the first thing is, you know, when you're known, you know, by your medical records that you're visually impaired, to be continually sent, you know, a hard copy rather than being emailed or texted. That was the first barrier. And I think once I nearly missed, you know, the appointment because, you know, I didn't have the support to access it. When you went to the environment, there was no offer of additional support, despite the fact that you were there, declaring that you had a visual impairment. You know, you had your cane, you were basically, you know, the usual stuff. Now you just go there, where is there? You know, you do this queue. You know, people would say to you, "Well, you're too close, wee man," because the flare was laid off. I didn't pick up on that initially. That you had to make sure you were on one line to the next line, and I didn't pick up on that. And then when you got to the front of the queue, you know, nobody came physically to address you. They just waved for, you know, 40, 50 metres away, and the person behind you to tell you and you didn't know where you were going, despite the fact that you've got your cane, you've got it in front of you, you're trying to find your way, and you're asking, and the stress, the embarrassment, the humiliation, it's all there, and I dreaded when October came in, I really did. But I knew I had to get the job because of my, my volatile and my vulnerability in terms of my asthma and so forth. But you've reminded me, I'm really not looking forward to this October either, to be honest. But nothing's changed, in the 4 years that I've been getting the vaccination. You try to liaise and explain, but nothing.
You mentioned the lines showing where people are supposed to stand and giving an indication of the distance required.
Yeah.
I mean, obviously that is not helpful to you. Do you think having some kind of raised demarcation would have been more helpful, that using your stick you might have been able to
I think what would be most
discover?
I think what would be most helpful if there was something within your community, like your GP, which you're familiar with. To me, that with people, we an impairment like myself, I couldn't, to me, that's an environment I'm familiar with. It's an environment I can access independently. But that would be my ideal scenario.
Yeah.
Blade out, you're right, maybe a raised, a raised platform so that you knew where you stood at it, But again, if you don't have distance vision, you could be stoning, it'd be really difficult to know when to move and so forth, because the other person in front of you is too far away, so you don't know when they've moved, so, sometimes you would move and you to move back again. It just, the whole thing was stressful. Yeah. I didn't look forward to it. I really, it's not something that that I found, barrier. Staff were great. They gave you an injection and so forth, but but the whole setup, there wasn't any pre-planning or awareness, and I'm sure I'm not the only disabled person that's maybe encountered that.
Yeah.
Because you've got to remember, for the first 18 months, I lived myself, so that care support wasn't there, so you didn't have a choice about doing it independently. You had to do it independently.
Yeah. Yes. So, in your opinion, if such a situation were to arise again, then those with vision impairments and other significant additional needs should really be invited to somewhere like their GP surgery or somewhere better suited for people with that impairment.
My personal
rather
choice,
than
yeah.
a centre where everybody is there and nobody is taking any notice of additional requirements.
I personally would rather it was at my GP's surgery, because my GP, they've known me for 20 odd years, they know my circumstances, they know the barriers, they put support in place in terms of, initiating support and providing additional services. So it's a good resource. So it would be ideal if the next inoculation for some people, there was a choice to do it a bit more locally. I mean, even, as I touched on earlier, trying to, navigate, well, I apologise if I'm being a bit presumptuous here ahead of it, but trying to, access the testing centre, and do you want me to go into that, or do you want me to...
I will go on to,
Right,
I'll come on to that as well, but the issue with knowing where to stand and being able to follow any one-way systems that are put in place, that would go beyond the realm of healthcare, and that would have been the case if you had, for example, tried to go grocery shopping or to access any other venue. Presumably you would have had the same issue, because to my knowledge very few places, if any, had anything beyond visual signs of the route to take or where to stand. So really, that's perhaps something that consideration should be given to across the board. Perhaps government guidance, future government guidance should consider the needs of those with visual impairments and require raised markings or braille or audio guides to be put in place. Would you agree with that?
I think the whole thing needs to, it needs to be looked at, and people need to be approached individually. If they, if they've declared that they've got an impairment that makes it difficult for them to access printed information and travel independently to unfamiliar places. I think that needs to be reviewed. Mm-hmm. And as I said, I have asked the question, but there's no plan soon to provide a more user-friendly, accessible environment in terms of being able to access this service independently. Mm-hmm. The last one, I did have a PA, so that resolved that. Mm-hmm. But again, when I went to the centre, there was 3 different areas, which I thought quite funny. There's a green area, the blue area, and the red area. And I thought, blue area, what one am I? It's just, go to the green area. My boy was there, so that was okay. Yeah. But I just harked back if I had to access independently. Mm-hmm. And it was in a different environment again. Yeah. That again, if I'd been there myself, I wouldn't have found it because they'd moved it a different system, a different part of a building. Mm-hmm. The building's that far away. There's no public transport from Motherwell to the inoculation centre. Mm-hmm. There's no public transport. Right. Sorry, there's a minibus that goes twice a year. But again, if you're not familiar, it's a learning curve as well. Yeah. Just all experiences doesn't hasn't any thought, I don't think personally, into people with impairments and potentially access barriers.
Yeah. Thank you. And I understand from your statement that at one point your son tested positive for COVID, and as you were a close contact, you were required to be tested. Could you tell us about your experience of the test centre? And I understand you were asked to fill out forms, so your experience of dealing with those as well. Again, your visual impairment, to try and find somewhere that you're not familiar with, it's very, very difficult to do independently. And because it was something as serious as this, it would have been irresponsible to try and find somebody else to accompany me, to the testing centre. So I did it independently. I got some good directions, for acquaintances. But the whole site wasn't accessible. It was a tent in the middle of a kind of strange area surrounded by fencing. I couldn't find my way into it. When I did get in, again, there was a fairly abrupt, I was stressed, there was a fairly abrupt reception. Then you were asked to, you were just handed stuff, I didn't know what to do with it. I needed somebody, ideally, it would have been great if somebody took it stage by stage, because I was stressed out my nut. I was really worried about it because of a vulnerable, health condition. Yeah. And I was thinking, if I get COVID here, what does this mean? And the whole thing was stressful. Then I had the additional, difficulty with to navigate and negotiate a system I wasn't familiar with, to handle stuff, to put in different bags, to fill out forms. And I had to I think 3 times I had to say to them, because of my visual impairment, that I would find this difficult. And just when, sadly, I'm ashamed to admit this, I did boil over. And all that did was make them defensive and less. But somebody did step in, and they basically helped me do the paperwork, make sure everything was organised, handed in, and do the paperwork in terms of recording your information and so forth. So it was done, but to me,
it'd have been really, really nice, bearing in mind the predicament I thought I was in, to have that resource and that support at the front door, because I was stressed at my napper, so you know, I wasn't thinking probably as straight as I probably could have. I don't know. I'm trying to reflect at the time, but I just remember, if I've got this, you know, I'm in serious bother here.
Yeah.
And faced with that totally inaccessible, and it was totally inaccessible. I couldn't find my way back out onto the main street, because it was a set of fencing that took you a completely different way. I was completely disoriented, and I ended up in the middle of a car park. You know what I mean? So it wasn't the ideal. It did take me a wee while to get my bearings, so it wasn't the ideal either.
Yeah. Thank you. Could you also tell us about your experience of accessing your GP services and getting repeat prescriptions during the pandemic?
Yeah. The thing with GP is you know, the GP kind of contact is minimal, but initially I had a couple of health issues, and you were diagnosed with a telephone conversation, and fine, you know, and then obviously as a result of that diagnosis, you get a prescription, you know, that you to get, you had to repeat prescription, and again, the difficult with that is there's no an electronic system to reapply for that, and when I got a carer to fill it out, you know, I didn't know where to post it. The staff were a bit stressed and, you know, a bit forceful, overly assertive, I think, when I explained to them that I didn't know how this process worked, and because of my visual impairment, I was really kind of disoriented. I didn't know where to pick this stuff up, where to drop it off. Gradually, we were able to resolve it, but the whole thing again wasn't taken into account as to terms of what provision can people with a visual impairment, how can we allow them to be more independent, fill in this application independently, you know, send it back to us electronically and pick it up, you know, through a better system. And it's no change since, unfortunately. You know, and it's purely by accident and default that I've managed to figure the system out myself. But, you know, initially, I had 2 illnesses here, you know, during the lockdown, and they were diagnosed, you know, early on. One was sepsis and the other one was shingles, I think. You know, I'm like, do you want me to take a picture? No, it's fine on the phone, Mr. Kelter, you know, so you know, you described your symptoms and you were diagnosed and you went to get these prescriptions and treat yourself.
I think eczema was also one of the ones you'd mentioned in your statement, and you had particular trouble with the repeat prescription for that. Would you like to tell us about?
Yeah, again, it's just basically, you know, you having to fill the forms out, you know, having to kind of go to the chemist, and again, when you're trying to, you know, kind of access your prescription, you know, you've got to, again, this physical, visual world we live in, you know, I didn't know when you went to the chemist that you're only 2 or 3 people in, because it wasn't accessible. You know, is that what you were alluding to, or have I missed the point here?
Yeah, I think you were looking to get repeat eczema prescriptions, but they weren't allowing you to do that. And I think possibly while that was permitted for some treatments, it wasn't for that. Yeah, and you had some difficulty putting that in place.
Yeah, all my other medication is a repeat prescription, but for some reason, you know, my medication for my asthma and so forth, that's repeat. But for some reason, this steroid ointment is beyond repeat prescription. They don't do it. So you've got, even today, you've got that kind of that struggle to get somebody to fill it out, to drop it off, to get back and get it, you know. It may seem trivial or, you know, kind of, what's the argument, but for some people, it is a big challenge to navigate, especially, you know, roads that don't have, you know, crossings at them and so forth. So just wee daft things like that. If it was done, you know, the same as other prescription medication, then it'd be an easier and ideal world.
Yeah, thank you. Now, you mentioned the laundrette before.
Sorry?
You mentioned the laundrette before and the issues you had with that. Is this a local authority laundrette?
Yeah, it's built into the tower block because because of the structure of the building and the age of the building, you know, no other flats have got the systems or the structure in place for you to put a washing machine in. So they've got a communal laundrette.
Yep.
And again, it's really difficult to, you know, it's not accessible. It's really difficult to access independently, and because it's all touch and settings, and you've got to top up a key fob and so forth. So the whole process is a wee bit tricky.
And you say in paragraph 73 of your statement that you were trying to see if the council could put in some kind of audio thing for the washing machine.
Yeah.
Where did you manage to get to with that? Would you like to tell us about that issue and what was done?
Yeah, they basically missed the point. I was wondering if the washing machines give an audio output, you know, built into all the machines, so that it could access them independently. You know, but that's never been forthcoming. They've never done that. But what they have put in place is a pay-as-you-go. So you've got an audio machine that you scan your bank card and put your fob in, and it tops up your credit.
Yeah.
But again, it's audio feedback. It's not audio input.
Yeah.
So it's post-COVID obviously, but kind of, you know, during COVID, then the whole system you know, was difficult to access. But they put it in place, but they haven't put in what in an ideal world which would have been better for people like myself, audio feedback within the actual machines themselves.
Yeah. And you also had trouble with the lifts in the tower block, is that correct? And audio feedback. Did you contacted the local authority about that as well? What was the response in that case?
Well, basically, again, because, you know, inadvertently, you went to the wrong door, you know, because I thought I'd hit the right button in the lift, and I got out of the wrong flare and tried to go to somebody else's house. What's their dismay? You know, so I went back to the local authority and I said, like, listen, you know, there's various barriers I'm encountering, and that was one of them. And so they announced that, you know, they didn't see what the problem was because they had an audio lift, but the other tenants thought it was a pain in the bahookie, so they turned it off. Right. You know, so when they realised that, you know, it would be an additional help to somebody like myself, they turned it back on, but it was never declared that it was in existence in the first place. You know, so it's been ideal, you know, to have that mechanism. But it's just surprised it took them over 3 years to appreciate that they have a tenant who has a visual impairment and would benefit for that additional resource to be in place.
The signs put up by the local authority in your tower block were all just visual signs as well, is that right? So you didn't know the information, such as the rule that only 2 people were supposed to be in a lift?
Yeah. I didn't appreciate that, and a couple of the times that one of the tenants, you know, kind of, you know, was overly assertive and reminded me that I should have been in a lift because it was already, you know, had the sufficient numbers in it. But again, the whole thing with North Lanarkshire Council, they don't live in you know, they don't apply the social model of disability.
Yeah.
You know, everything they send you, you know, vis-a-vis everything happening within the flat is always in a, you know, kind of visual format. The only thing they tell you, surprise, surprise, electronically, is that your rent's got up and they email you that, but everything else, in terms of changes to the building, adaptations, so forth, it's all visual signs. And through the first year or so of COVID, there was that continually. You know, I went to the, you know, tried to get a top up for my key fob for the laundry, and it transpired that the local authority were giving you free access, but I was never notified about that. So it was really difficult, and people were, well, these signs were up notifying, I didn't know it was there. The thing about the lift, I didn't know it was there. So, you know, North Lanarkshire Council still live in a fairly kind of medical model orientated world in terms of the way they interact with their disabled tenants, I think. And you know, it would be nice if we could see quicker and more rapid progress in terms of vis-a-vis accessibility to things like information and services.
Yeah. And the lack of progress and provision of such services aren't in any way down to your lack of trying, because my understanding from your statement is that you have repeatedly, for quite a long time, contacted the local authority and continuously made them aware of your needs and how they could make small changes that would make a significant difference for you and others with visual impairments.
Definitely, yeah.
Correct?
Yeah. I mean, you know, as I said earlier, you know, it was all, for 20 years, I was continually asking the council if they were able or willing or prepared to set emails either in Braille, you know, information either in Braille or electronically, and they said their system wasn't set up for that. You know, and the consequences for people like myself, you know, if you don't have access to the information to make an informed decision, there is dire consequences. I did get into debt because, you know, I couldn't access the information. Obviously, this is prior to COVID, but it still continued through COVID.
Yeah.
You know, you'd be presented with information that you need a third party to access, and time lapses, and before you know it, you know, you're over £600 in debt with rent charges. So the consequences aren't directly affecting the local authority, it's the individual. And the fact that it's took them, you know, 21 years to send you a letter informing you about the cost of your rent and your council tax charges. But they can send you letters about a lot more other stuff happening in and around the building.
Yeah.
You know, vis-a-vis your local environment, but they don't.
Yeah.
They think this is enough, I think.
Yeah. They don't send emails about those issues.
No, the only thing they email me is the increase to my rent and council tax, nothing else.
Nothing else.
You know,
They
work
told you-
happening in the building, lift repairs, you know, everything through COVID. There was nothing in terms of, you know, kind of, you know, the adaptation to the lift where only two people could be in the lift at any one time. I didn't learn that by default. The fact that you didn't have to use the laundry, you know, they didn't announce that. So there's things time and time again. You know, fortunately, latterly, I've got to know a couple of people in the flat, and, you know, one of them is particularly good at flagging stuff up if I'm not aware of it. The local authority are really, they've got a long way to go to make their service inclusive.
Yeah. And you said that they told you their IT system isn't set up to email.
No, that's what I said. It took them 21 years to, you know, to amend their system so that they were in a position to notify people about issues, you know, vis-a-vis, but primarily initially, you know, with the council tax.
Okay.
You know, that was my main issue. You know, kind of work happening in the area. You know, kind of, you know, public, you know, occasions in the area. That was all done via paper. They said, and they were adamant, they've reiterated it, the system was not geared up to sending emails individually to people. And it only happened in 2021.
Okay, thank you.
Was it 22? I can't remember.
And
whenever the Quality Act kicked in.
thank you. And then finally, in paragraphs 87 to 89 of your statement, under the heading "Disabled People at the Mercy of Local Authorities," is it your view there that those with visual impairments should be registered with their local authority and provided with sufficient appropriate support in the event of another pandemic or emergency, so that the local authority should have a database of people with visual impairments so that they can actually proactively step in and make the sort of communications that you've spoken about and provide support? Is that something you would like to see?
Yeah, I would like to see it primarily at all level, for for the top down, not just for your local authority. I think ideally I would have loved it if the Scottish Government had a greater insight and awareness about the challenges that somebody with a visual impairment would encounter, and that's been the sorest point to myself. For the best part of 11.5 months, you had to try and basically be as independent as you can. You became much more withdrawn so that you could survive, you could get by, and that's because there wasn't I'm presuming there wasn't a greater awareness of the predicament and the barriers experienced or encountered by people with a visual impairment, and that's not just the local authority. I mean, I'm resigned to the fact I expected absolutely nothing from the local authority, because I had 21 years experience, or prior to COVID, I had 19 years experience where I knew they weren't going to provide anything. So the local authority wasn't a surprise to me. The Scottish Government provision, that did take me aback, that, that as a registered blind individual, I was deemed to be, a member of a group that they needed additional support. That did surprise me.
Thank you. Now, we have your statement and we'll consider that in its entirety alongside your oral evidence today. Is there anything that we've not covered that you'd like to mention or highlight at this point?
Again, I think the work going into preparing the statement and the support I got, primarily for GDA, I think we're fairly, we've covered everything. I really don't think, there's anything, the experiences, good and bad through the COVID period. I don't think there's anything there that has to be captured. I'm fairly confident that we were able to, to capture everything due to the time and effort put in by primarily GDA to, coax, the right questions, to draw out the right information, and, make sure that the barriers that I experienced were captured.
Thank you very much.
Cheers.
Yes, thank you, Mr. Kelter.
Cheers.
Very good. That's all for today, Ms. Barami.
Yes, my lord. Thank you.
And it's tomorrow afternoon, I think, that we're due back.
That's correct. Thank you, my lord.
Thank you. Very good.